Hello everyone and welcome to the IEEE Turkey webinar. My name is Beyza and I'm IEEE Turkey section EMBA student representative. We are pleased to have you with us today and we would like to thank our distinguished speaker Dr. Luis Kuhn for joining us. In this session we will explore how healthcare is being transformed through the convergence of science and technology. Without further delay, I would like to hand over the floor to our speaker. Enjoy the webinar.
Okay. All right. Okay. Let me. Good morning, everyone. Well, good afternoon to you. Let me see if I can expand this. Okay. I would like to dedicate this talk to Dr. Banu Onaral. She was from Turkey. It was a great colleague that ended up working at Drexel University. Unfortunately, she passed away on December 18, 2024, but we worked very closely for many years. What you're seeing now is a global map where you can see all those little yellow points are airplanes that are flying from everywhere to everywhere else. And this is one of the ways disease is transmitted very fast around the world. Let me go back here. And so this is another way that also disease moves. And because of climate change, we have extremely strong winds that bring insects and microorganisms from northern Africa into the Caribbean and the US coast, and sometimes infections were detected. And this already was documented by these pictures taken by NASA in the 2001 timeframe. This is also another way that diseases are transmitted, and this is by birds flying from very different parts of the world. They migrate, they bring infections, and of course, there are no boundaries, and this has all types of consequences. Some of them were shown with H5N1. It created heavy losses, and it started like in July of 2022. But then around Thanksgiving time, where people eat turkey in this country, millions of birds had to be killed. And this is a map of what was happening at that time. But I'm showing you now numbers from less than a year ago. This is about 168 million animals were slaughtered because of that. And what that does is, like it or not, there are all types of consequences. And my talk will show you connections that perhaps you don't appreciate because you're very much concentrating only on one area of your work. But it's good to understand some of the ramifications. For example, we use eggs to fertilize what it will become a vaccine for the flu. And of course, if those eggs are contaminated, now we have an additional issue with the production of this. So some people have been talking about accelerating and changing the way we do vaccines, and instead of taking days and weeks, because normally the northern hemisphere uses the recipe of what happened in the winter in the southern hemisphere and vice versa. So it takes a long time for all these things to process. And of course, as I said, if things are infected, it creates a huge problem because how can you produce it fast? And then in terms of the numbers, the millions of vaccines that are needed, and then the distribution becomes a nightmare. These are some of the big issues and threats that you will be hearing about: population growth and urbanization, the problems of generated by global warming, excessive waste and pollution of the soil, the air, and the water, all the issues about transportation, COVID, the wars, and the water crisis. They all touch in some ways public health. In the 1950 timeframe, the world population was about 2.5 billion people, and the life expectancy was about 45.5 years. By this year, the population now is 8.3 billion, and the life expectancy is 73.8. Obviously, for women, it's a little more. For men, it's a little less. But every day, when you add all the people that are born, subtract those that die, you have actually around 250,000 new individuals. And of course, every 4 days, then you have 1 million more people in the world. These people require water, food, and energy to survive. The distribution, it's pretty much about 60% in Asia right now, but that number will change substantially because Africa, which is 14%, is growing 5 times faster than the rest of the world. The Americas are another 14, and Europe is about 12%. The big concern about urbanization is that obviously as the density increases, the propagation of communicable diseases is a big issue. And another one is because of political issues, economics, religious, social. I mean, people migrate, or they're forced to migrate even because of wars or natural disasters. And these people, there are some consequences that are really important to take in consideration. If you look at the top left, you will see as the years go by, the diameters of these circles increases. And when we reach the year 2100, at the end of this century, these are all mega cities, and 13 of them will be in Africa, and 7 will be from Asia. These are not countries, but cities, and the population would be huge, really huge. Lagos, for example, in Nigeria will have 88 million people. So you can imagine the problems from a public health perspective are tremendous. Education, food, water, all these are incredibly important. But I also developed a chart I found some years ago in 2021, a report from the World Economic Forum, which showed that Pakistan and Bangladesh, with those very large number of population, only 17.1 and 12.9% of their population had access to internet. So now imagine how do you reach the population in terms of disseminating important information. And so this brings me to this chart that I developed, where you have the countries in green are from Africa, the ones in yellow or orange are from Asia. Now, if you look at the last column on the right, for example, the second city, Kinshasa from Congo, 91% of the people have no internet access in 2019. And this is not going to change because of the very rapid growth that goes on. If you look at number 19, Mogadishu, 98% don't have access to internet, and everything else is in between. So, of course, if you don't have food and water, electricity, or even the infrastructure, internet is not going to be a concern of yours. But for society, we need to find ways to reach these people. In the US, there was a study done at the Agency for Health Research and Quality, dated July 27, 2021, which showed all this different communities, basically, and the darker that blue, that means that they had full internet access. But as you move to the southeast, you see more white. These are a lot of farm areas, but between 22 and 62% of those homes have no computing devices. So you wonder how they get their information, and that's also a considerable problem. There are some numbers that I don't want to emphasize now, but you should be aware that there's a lot of people that cannot read or write. A lot of them have not attended college. They make very little money. There is very little access in some places of drinking and clean water. This is a big problem. And of course, as we check the news, we see, just as an example, that 1.9 billion people drink every year the waters that come from the melting glaciers in the Himalayas. And these are disappearing because of climate change. So where are these people going to get their water? Are they going to have to migrate? And you see it all around. It's not just one part of the world. You see it in Europe with these numbers showing the very fast melting. In addition, you have all these problems of forced migration because of different motives. But actually, we have at least 123 million people that are displaced, and that brings people from all over the world. These are just some of the places where you have, I highlighted here that Turkey, for example, hosts the largest number of Syrian refugees at 3.1 million. This is going to affect all of you because the scales of the economics that forced migration causes on others is very, very large. So you have technological and accidental hazards, which are many. This happen frequently. You also have things that happen that you might not be aware, like the dumping of radioactive waste in the 70s. The reason this becomes sudden a big issue is, for example, there's a dome in the Pacific Ocean and the Marshall Islands that where a lot of radioactive materials were put below that cement, but the cement is showing some cracks. And pretty soon, because of climate change, the ocean is going to cover this dome. Therefore, radiation is going to escape into the water, and of course, that will affect our, the food chain. You probably, some of you should remember what happened in Fukushima that started with an earthquake, then a tsunami, and the explosion of the nuclear reactor. And of course, affected a lot, not only of the agriculture and everything around that area, but also the dumping of the water in the ocean. Uh, Creates a problem of contamination of the fish that we, for example, for sushi. On the global economy, you have no idea what you're eating, where it came from. And so those are big issues. During 2013, there was an article on The Guardian, the UK, that showed 30 different towns in Texas that had plenty of oil and plenty of natural gas, and they were doing fracking, which uses water at a very high pressure. But the problem is they ran out of water, so people had to move out. So, we can live without oil or without gas, but we cannot live without water. Of course, in addition to all of this, you can have things done on purpose. So it's not just a derailment of a train that could be an accident, but it could be maybe done on purpose. And now, but the way we have to react is pretty much the same. And the same with the natural disasters. These are some of the major events that happened last year around the world, from fires, temperatures exceeding very, very high temperatures, and so on. Big problem around for food production, for example. This was in Valencia in Spain, floods. These are started around 2022, but they have kept happening. And here you have a country that is the third production of agriculture in Asia comes from Pakistan. So big problem. And of course, the melting of glaciers, in addition to the weather, is creating lots of problems. These were places that I identified before that in all around the world. And on the other hand, you have the fires and the droughts, which create a problem. This is from March of this year. We're talking just a few days ago, breaking all records on temperatures on the west coast of the United States. So, on the other hand, this is on the eastern side of Africa, where you have all types of problems with agriculture and with cattle, animals dying because of lack of water. And if we look in the United States, something like Las Vegas that started slowly, like a small community, kept expanding. More and more people would move there, and of course they wanted to have the little grass and the golf courses. Well, the problem is that the water to water those lawns came from Lake Mead, and that's where Hoover Dam is located, which is a critical infrastructure for the production of hydroelectric power, in addition to being critical infrastructure from a tourism point of view because of the millions of people that come to visit. But it also produces the water that will go to California for agriculture purposes, and that's basically non-existent now. Just in 4 years, from 2000 to 2004, the water went down 18 meters, and it kept going down. The lake kept shrinking, and as you can see, the walls, the water has kept going down because more people keep moving to Las Vegas, and like it or not, that's a desert. And so the use of water has been excessive. And in addition to that, there's a problem called, well, subsidence. And what happens is, as you start using the water underground, the that tunnel basically collapses. And in areas like San Jose in California, the land has subsided about 28 feet. It's going to be covered by the ocean. So that land will be lost for forever. I mean, these are irreversible processes. But also in addition, what happens is the rock contains arsenic, which causes cancer, and that those little rocks dislodge and go to the bottom where the water still exists, and that water goes across, the state, and is used for agriculture. So around 2012, they found that 30 wines from California contained high levels of arsenic. These are the problems that many people do not look like, but they are very important to consider. This is another lake called Great Salt Lake, which is near Salt Lake City. And the orange area is basically where the water used to be. It has been shrinking, and those three rivers bring sediments that are mostly arsenic. So if all the water would disappear, the people from Salt Lake City will have to move out because the winds would bring all that dust that creates cancer. Example of the type of things. In Turkey, you might maybe some of you were affected by the big earthquakes that you had in February of 2023. To make this even bigger, when you look at the bigger picture, is that also later that year there were earthquakes in Morocco, and there were also floods in Libya. And this created mass exodus of people in the Mediterranean towards Europe. From what I understand, about 720,000 migrants arrive in Europe into Greek. A lot of this, most of them coming from Turkey. So big problem. Deal with information sharing, critical thinking, and some of these issues that I start telling you about digital exclusion. Now, in addition, the wars don't make life easier to anyone. And most people, when I mention to the students the war, for example, between Russia and Ukraine, they think about destruction, about death, about the guns that the Ukrainians request the West to fight the Russians. But nobody talks about that part of the world that produces over 30% of the agriculture. There are 52 countries that depend on that grain. And if they don't get that grain, boom, you're going to have famine. So you have people going all over the place, different countries, Slovakia, Poland, Hungary, Romania, all speaking different languages. And this is an area that having, for example, a small card that contained medical information and that could be translated to any language could be great, help for those mothers that are taking children. These are all countries that are getting all that agriculture from the Ukraine and Russia areas. And so you can imagine the crisis that wars develop when this happens. Also, because of the other war that was happening in around 24 between Gaza and the Houthis with Israel, um, that basically the ships stopped going through the Suez Canal, and that pretty much ruined Egypt's economy because more than half of their income came from the passage through the Suez Canal. So now the ships had to go 6,000 kilometers around Africa. And of course, that makes things more expensive. At the same time, you have, besides the Suez Canal, you have the Panama Canal. And this system, for those of you that are not aware, the Pacific Ocean is about 26 meters higher than the Atlantic. So there's a group of pools that was created to fill, with water. The ships will go to a higher level until they reach the other height. The problem is that until 2012, the ships that went through there were about 30,000 to 70,000 tons. They expanded, so they made the passages of the Suez Canal wider and deeper. So the ships that go through there now are 300,000 tons. And the problem is because of the climate change problems, they cannot fill with water those pools. So either the ships have to put less cargo, which will make, then they will have to make more trips, or they have to go around South America, which would lengthen even by weeks the cargo. So all of these issues, they're not politically motivated, but they are creating that items become more expensive in the global economy. Now, this is a part that you should pay a lot of attention because as we advance in science and technology, we are extending life, and that's that first chart that I showed you, that we are now 8.3 billion. The problem is that the more you live, the more chronic conditions are going to manifest throughout your lifetime, which means that as you get older and older, more in parallel, you're going to have many conditions happening. So you become very expensive. And the last year of your life, unless you die from an accident, it would be the most expensive one. No country can afford that. So what I've been lecturing for decades now is that we don't need just to reform, but we need to transform the system. So imagine, instead of going to the doctor when you feel sick so that they would diagnose, treat, and cure you, you start going very early when you're young, and you go when you're well. And the purpose is to stay well. So you maintain and you prevent disease from manifesting. So the ideal would be that you just die from old age, but as healthy as possible. And all of that hopefully could be done through prevention. So imagine if in grammar schools, children would be taught about nutrition, diet, exercise, yoga, relaxation, and now you start avoiding obesity in children. So you start avoiding problems of diabetes, high blood pressure, but then the cafeterias in the schools have to avoid hot dogs and French fries, as an example. Now, the importance, that point number 4, the importance of multidisciplinary and interdisciplinary teams to resolve any problem, to me, is fundamental. And this is something that I encourage all students around the world to form teams, because we tend to work in silos. We specialize on something, but we have limited knowledge about everything else. So let me give you an example. We imagine the word threat. So if I ask a policeman about to think about threat, he or she would think about guns, knives, explosives. If I am talking to a firefighter, they will probably start thinking about smoke and fire. If I talk to a cook, they will think about the temperature of the stove or the oven. If I talk to the owner of a theater, he probably or she will be thinking about Netflix. On the other hand, if I'm talking to the owner of a little store in the mall, they will be thinking about Amazon and internet. If we are talking about the people at the airports, they see the plastic bottle with water as a threat, but the environmentalist only sees the plastic. The public health only sees the water. And this is my point. If I ask one of them to write a paper about threats on one hand, and then I ask this whole spectrum of people to write another paper about threats, the papers are going to be completely different because they will cover angles that you never thought because they are not on your radar. And this is my whole point on the importance of bringing people from very different perspectives. So you probably have seen a lot of very different layers that you work, and this is what I was talking to you, going to a system that prevents disease, focus on wellness, and we're going to be incorporating more and more genetics, public health, and geomedicine. This was something that IEEE Spectrum published in 2010, and the prices have gone completely lowered because of changes of technologies. Now you have DNA analyzers and genome sequencing that can be done very fast and are not a lot cheaper. So we have, I do not know how many of you are familiar with CRISPR, but this is a gene editing, which is a fantastic principle. Imagine a pregnant woman where some disease that has been identified as a genetic one, and where physicians are able to edit the DNA while the fetus is still on the mother, and the consequences of that, the long-term consequences, are terrific. So this is something that you might want to investigate, this CRISPR project. In 2015, the Chinese already start doing certain things, and that's good. For those of you that are seeking careers in health informatics, I think the two extremes where you see the red arrows, one is at the micro level, molecular, cellular processes and genomics, personalized medicine. That's terrific. But the other extreme, which deals with environmental and public health, is also one that requires more individuals to get involved. And of course, we're shifting to home care, and this was something that was published by me many years before COVID happened, in terms of using the home as a quarantining place. And of course, these are the things that we did during COVID: distance learning, telework, telemedicine, and e-commerce. But again, what do you do with that huge group of people that create that digital divide? From an integration point of view, we're seeing more and more this type of situations, that remote surgery, those arms that you see on the top left, these were tools created by NASA for the space station to fix pieces of that station, and that now are used in every single operating room around the world. The physician in the middle is looking at the patient indirectly through huge magnifying glasses. So you can imagine when he's doing a cut, he can really see a lot of more detail than just cutting without that help. And of course, when he or she is sewing the patient, the same thing. You have a lot more discrimination, and you can have more perfection on what you're doing. The infrastructure are many, and of course, you may have seen the drones that bring blood and medications. Of course, this from the society, one of the societies that I represent, the Society of Social Implications of Technology, the same drone that brings elements that save lives, they can also bring bombs and destroy lives. So the technology is pretty much the same, but the way we use it is what we should worry about. This is a video that showcases a young lady whose father had a heart attack.
112 operator, what is your emergency?
It's my dad. I think he had a heart attack. Please help. He's not breathing anymore.
Please stay calm. What's your name?
Joanna.
Good. Joanna, we've got your location. The ambulance drone is on its way. Remove his top shirt to uncover his torso.
Okay.
Look at the clock on the top left.
Great. Can you go to the nearest exit? The ambulance drone is almost there.
Okay. I'm outside.
I'll be talking through the drone now, so you can put down the phone. Now please pick up the drone and bring it to your father. You're doing great. Okay, pull the green bit. Now place the pads on your father's chest. Good. I can see that the pads are properly applied. Joanna, please stay clear of your father. We'll take it from here.
Okay, as you saw, it took 1:58 seconds. This was developed by students in Amsterdam. But the point is that with the growing cities, urbanization, and traffic, it's very difficult for ambulances to move very fast. The drone is a perfect solution to decrease the time of a heart attack and the immediate treatment that will increase the outcomes favorably to that patient. So this is a wonderful, wonderful tool. And that's why I wanted to share that with you. On this picture, you see from the left children through teenage, adult, and elderly. The picture becomes more and more complicated as you go to the right, and this is what I was telling you, that ends up becoming very expensive. At first, in general, you don't have to go to a doctor very often, but if you want to do prevention, maybe things should be a little bit different. Of course, the vision is from birth to death, to intervene, predict, avoid, manage, and so on. And of course, you're going to be looking at the family history, genetics, environmental exposures, lifestyles, injuries, chronic illnesses, and so on. Now, let me talk to you about geomedicine, because this is becoming more and more relevant. Of course, health and well-being begins here with the pregnancy and when the baby's born. So what makes us sick is our neighborhoods, our houses, the paint that we might use, the different products that are on the walls, our behaviors, our freeways. In 2022, for the first time, plastics were found in the lungs of patients. And of course, if you go to the Pacific, you're going to see islands of plastics. And then the fish eat the plastic, we eat the fish. So that it's easy to see how some of this microplastics get into our organisms. And so we need to fight all that trash. This is something really incredible, but it's a chart, this air quality index developed by EPA, is an Environmental Protection Agency, and it goes from 0 to 500. If you reach around 100, people with asthma, for example, need to worry. On the other hand, if you go anywhere between 300 and 500, it becomes hazardous and you should not get out of your house. So this is something hard to believe, but in Lahore, in Pakistan, on November 4th, 2024, they measured 1,900 on this scale. I was at the University of Montevideo speaking, and of course, nobody knew about that. I asked them, nobody knew. But that's the highest ever measured. These are the most polluted cities in the world. And if you look at the pictures on the right, one was the normal, the one below that it's clean, that was during COVID. There was basically no traffic in New Delhi. But New Delhi and Lahore, they are a corridor that where about over 40 million people live. And the quality of the air, both in Delhi, several times they have measured 900. But this 1900 in Lahore and in New Delhi, it's just a disaster. And so you find at least 5 million children whose lungs are already ruined. And Beijing, same thing. And there are many, I'm not going to dwell any more on this, but it's huge, the amount of problems generated by pollution and climate change. Our medical services are also a big problem in the U.S. Lots of people die from medical errors, and these are all generated. To Where is Human was a book published in 1999, already spoke about 45 million to 98 million people I'm sorry, 1,000, but it's a huge number of people that died from medical errors in this country. That number around 2012 went up to about 400,000. So it became the third sort of death after heart disease and cancer. Terrible. Our drinking water, our waste, our nature, because of pesticides and other products that we have. Obviously, with the use of geographical information systems, we can even identify places where people might have, in this case, it's smoking cessation or heart attacks, and even the location of toxic areas you can determine thanks to that. So this is a diagram that I designed to explain how the electronic medical record should look in the future. All the things that you see here on the right are the factors that come from geomedicine. On the left, you have all this list of things that I believe that we can educate children and adults, which is information from wellness data. There's a lot of behavioral information that we could get from psychologists and psychiatrists, but we should include immunizations registries that today most people around the world have it in a little piece of paper that they don't even find. Dental and vision information is important as well. Genetic information, prenatal information from the mother becomes important as well. And of course, postmortem information can be helpful for future generations. Okay, so these are reasons why that critical thinking becomes very important. People don't understand completely interoperability, and that's why I was telling you about this multidisciplines and interdisciplines. And in general, the islands of excellence, I was trying to refer to those silos of information that I created. In the global economy, imported food is a huge issue. And so the FDA and also the government of Canada were looking into this problem. And of course, you go to any of the big ports and you find thousands of containers that have food. And you don't have enough people to check them all. So some people work smart using AI and other tools to qualify and quantify the information a little better. And so they developed this algorithm, but also they focus on three areas, which were the country of origin, the food that you're discussing, and the hazard involved with that food. And then they were able to pretty much create this list with high risks, basically, in that third column. So diseases like E. coli, salmonella, norovirus, and so on could be identified and know exactly where to look. And they're having a great success with this because they can reduce the number of people by going straight with what they have to the areas that are the highest risks. And that's what is taking place right now. There's another model that I saw in Uruguay. We had a barbecue after a meeting of ministers of defense. And during the barbecue, this lady grabbed the microphone and said, this was the cup holder. And she said, please turn them around. So everybody saw a code. And then she said, put your phone, it didn't matter if it was an iPhone or a Samsung. And basically the system immediately would tell you where the meat that you were about to eat came from. And this is a traceability system created in Uruguay by the National Institute of Meat, where you have an RFID, you see caravan here, and then the same number can be legible if you don't have a way of detecting that. And every cow, there are Uruguay is very small. It only has 3.5 million people, but it has over 12 million cows, and they are all in a database with GIS coordinates. They know exactly the water they drink and the grass they eat. And therefore, for the rest of their life, that number accompanies the animal. The day the animal is, killed and cut and put into boxes, the boxes contain that number. Now, imagine in the future a supermarket doing IoT, Internet of Things, basically with a sensor in your refrigerator. The supermarket could know that you're running out of meat and offer you to send you more. But at the same time, if the number that you have in the meat in your refrigerator coincides with something that is contaminated, now they can use it for disease prevention and tell you, please do not eat that meat, go to the doctor, bring it to the supermarket for a refund or throw it away, etc. This is part of how some of this technology can be used in that good way. Another big problem is that elder people are finding the price of drugs too expensive, so they buy it through internet. But how can you assure yourself that what you're buying is what you're getting? That maybe it's false advertisement, maybe the ingredients are not the same, maybe it's lacking the quantity of certain ingredients. So there are a few articles that came on IEEE Spectrum and on IEEE Computing Age in September 2019 that talk about the use of blockchain to basically document step by step, so that you can basically have a good traceability on the production of what you're buying. And so that can be, it's in some ways, it's kind of like an information assurance. This is another example, and it's using data mining with epidemiology and surveillance. When people have symptoms of a cold, they already know what to do. Although you might not have fever, you might not go to the doctor yet because you're still not sick, but you feel tired, and people already do certain things. They take orange juice, they take chicken soup, they take Tylenol, ibuprofen, and every product that you buy has a code. And that code, when you buy it, it goes through the system and tells the owner of the store what was just purchased, so that they can put products on the shelf. It also is a system that allows, let's assume that you have 100 boxes of Coca-Cola and you sold 90. When you reach that level of 10, maybe an automatic message is sent to the producer to send you another 90 boxes to replenish. And so the tool was done for those purposes, but now we can use it for health purposes, because if we create a geographical information system where we plot every single supermarket and every single pharmacy in a city, and we now detail the number of sales on those products that might be part of a list, that might incorporate aspirin, it might incorporate Gatorade, orange juice, chicken soup, and so on. Now we will get some sort of an idea of what might be happening in that city. In addition, the first people to get sick are children. So if we also incorporate into that map the absenteeism of children in grammar schools, both private and public, Now, remember, these were all symptomatic information, but we can get somebody from public health to investigate. And that's basically what the system does. The reason this, it might seem very simple to you, but this is the symptoms of a cold are the same that are shown in bioterrorism. So if you have a contact with anthrax or substances like that, you feel like you have a cold. Externally, it seems the same. If somebody would take an X-ray of your lungs, they would look completely white. And that's what happened 1 month after 9/11. Some fellow that worked in the post office that got contaminated with that powder was asked, "How do you feel?" And he said, "Oh, I just feel tired." The next day, he died because nobody took an X-ray. But that's why the system was developed. But the point is that here you see down this red cluster that tells that something is going on. And so that's how you're using then information technology through epidemiology and surveillance to try to attack a problem. Okay, so I'm almost done. I just want to mention the problems that this is generating, because when you have when you're dealing with medical school, you might not learn new diseases. There are emerging diseases every so often. And sometimes clinical guidelines are developed so people in an emergency room would know how to act. The problem is that if you allow AI to produce that guideline and the information that they gather is false, now you might be killing a patient. And physicians that have no education on computers, on how they work, or on AI, could have a big problem with this type of situation. So your role as a medical or public health informatician becomes essential to make sure the reliability of the information that is used by the system. Anyway, this is just a final picture that I think it's extremely important to connect these 5 colors. The one in violet on the top left, these are technologies. The ones in orange are geopolitical. The ones in red are societal. And the ones in blue are economic. And the ones in green are environmental. So all these areas connect at some point or the other. And so, I was a few days ago in Chile when they were talking about the war between Iran and the U.S. and Israel. And some people were kind of like, well, we're so far away. But then they start thinking, wait a second, the products that come to the supermarket are brought by trucks that use gasoline. The price of gasoline goes up, so that's going to affect us. The traffic to go to the airport, they told me it will take you about an hour. And well, it took me 25 minutes because there was a lot less traffic because of the price of gasoline. If you buy a ticket, doesn't matter where you live, to fly on an airplane compared to the same ticket a month ago, maybe it doubled because of the price of gasoline. So it can affect anyone everywhere when you start connecting the economics with the environment, with the technologies, and with society. So some of the conclusions there is, what do we do with that 60% that don't have access to information? Reemphasize the importance of clean water, food, and energy. the forced displacement of people for different reasons, it's a big problem, and perhaps we can help them with some sort of an identity card or electronic health record that could be translated automatically to any language. Carrying that card can help make their lives to be a little easier. I told you about the importance of transforming the healthcare system, and where wellness becomes the center through prevention and incorporating genetics, health, and geomedicine. And by the way, that part, it should include not only medical informatics, but public health informatics and nursing informatics, because remember that still 90% of the time, if you go to a hospital, the nurse is the one that takes care of you. So their role is very, very important. Everything is connected and yet disconnected because of the way we work on silos. The importance then of analyzing in a holistic fashion, and that's why we need those multidisciplinary and interdisciplinary teams. The use of complex dynamic systems approach, because when you start defining a problem, by the time you're going to implement, the requirements might have changed. That's pretty much it. Now, my last message to you is that you need to act local, but you need to think global. You need to be alert on what's happening around the world, because anything and everything that happens outside your city or your country will end up affecting you one way or the other. So I appreciate your help listening, and I think I'm done here.
Thank you for this beautiful presentation. We can wait a bit for the questions.
Okay.
You can leave your questions in this comment section. While we are waiting, I have a question.
Sure.
Why is geomedicine not widely used yet?
I'm sorry, why what?
Why is geomedicine not widely used yet?
Oh, you mean the model?
Yes.
Well, the problem is, like it or not, the financial side of things tends to drive the world. You know, you might have 95 or 99% of the people in the world might want peace, but for those that produce bullets, peace is not a good business. So if there's not a war, they're going to create a war so that they can sell their bullets and their systems. Same way, if we were able to prevent disease, the pharmaceutical companies are not going to be very happy, because to start with, they don't make a lot of money with vaccines, because that happens once a year perhaps. But they make money with those medications that you have to take every day. So if you have to take this little pill for the blood pressure every single day, somebody's making money from that. If you now avoid high blood pressure completely and nobody else will have that, somebody's going to suffer the economic consequences. And that's what I'm saying, how things are connected and yet disconnected, because we as scientists or researchers don't tend to think on that. But there are implications. Also, I could tell you that we could give, I mean, the world is rich enough to be able to give to every person that lives a free computer and a free telephone. But yet, they will not be able to use it if they're not educated and if they don't have the infrastructure that supports that. So if you don't have what we call a home or a house where you can connect and you can charge your phone and you can talk to people, well, that's a problem. But if you don't even have clean water, or these social aspects are so important that will determine if you're going to make it or not. And so it's and I guess that's the main reason to answer your
Yeah,
question.
thank you.
Sure.
We have a couple of questions. Hello, first of all, thank you for your presentation. When will nanotechnology have real clinical impact?
Well, I think that on one hand, I have a watch, I have a ring, I measure a lot of different information that is very useful for me. Nanotechnology can have a wonderful role, but in the incorporation of wearables, particularly, and so I think monitoring individuals, they're going to be issues related to privacy, because if somebody gets the information knowing where that person is, then you have a problem of security. But imagine a person that might have dementia, that might not know where he or she is, having a little chip implanted that at all times allows relatives or somebody to know where they are, and be able to find them, can facilitate that very easily, and it would not cost that much money, because of but clinically it's very important, because if the hours pass, this person will become dehydrated and all the other problems that relate to that.
Yeah, thank you.
Yeah.
And also in the context of healthcare, transformation through science and technology convergence, what do you see as the biggest barrier to achieving true interoperability across disciplines and systems?
Yeah, well, the critical thinking is very big. I believe, for example, that the people that in democracies, the people that make the rules and regulations are Congress people, representatives, senators. But these people in general, the majority, are lawyers that have no science and technology background. The papers that we publish in IEEE tend to be papers that are made for engineers that understand derivatives, calculus. We need to write more articles that are geared to this other set of people that make the policies, so that it's more digestible, that they can understand in plain English or in your language what is the goodness of this system. So this will increase your chances of getting funded, and also will improve whatever is being made, because the fact that we work on silos, that means that you just are educated on this field and might not know what's happening next door. Let me give you a couple of examples. In 1978, while I was with IBM, I saw in the IBM Palo Alto Scientific Center, a guy by the name of Bill Hansen. He developed some algorithms to analyze images from satellites. 10 years later, in 1988, I was with IBM in Dallas, and Dr. Steve Harms bought a RISC 6000, a small computer, but very powerful. But there was no software to do. And what he did was he would analyze magnetic resonant images to detect breast cancer in women. Well, I talked to Ralph Bernstein, the manager of Bill Hansen, and he allowed that software to come to this man. I forgot about it, and then another 8 years went by. I was in Washington, 1996. My boss asked me to go to a conference on technology transfer. And suddenly I saw that this guy at Baylor had detected cancer in women using the algorithm that this other guy developed for the images from space. Similarly, the Naval Research Lab developed algorithms to detect mines at the bottom of the ocean. Duke University grabbed those algorithms and used them to detect cancer. Today, in Pennsylvania and Philadelphia, the University of Philadelphia uses those algorithms to detect cancers on kidneys. So my point is, you're not going to find a physician that will be reading magazines about mines in the bottom of the ocean or satellites and their images. But the key words become very important. The role of librarians is going to be fantastic so that we can share information. That's what I meant by information sharing of my presentation. You might find that the problem that you are seeking a solution already has a solution, but you're ignorant because that's not your field. So that's how in the future, I believe, using keywords, using the knowledge of librarians that know how to store knowledge might allow us to be more intelligent and use and find out, oh, here is a solution that might work for me. So that interoperability comes from that to be able to work out cross disciplines using the same machine, or in some cases the same algorithm. Anyway.
Thank you.
All right.
I guess that's all. If there are no more questions, thank you for everything, being with us today, and for sharing your valuable insights. Thank you for everyone for joining us. Hope to see you in our future events.
All right. I hope that things change by May, and I would love to be there. But I wish you all good luck and thank you for your time. Good luck.
Thank you.
Bye bye.